The Confidence Doc podcast is brought to you by My Evergreen Med Spa. Located in Houston in the Woodlands, My Evergreen Med Spa brings to you the latest aesthetic treatments in the most luxurious environment. Remember, My Evergreen Med Spa, it's me time elevated. Welcome to the Confidence Doc podcast. I'm Dr. Rednam. I'm a board-certified plastic surgeon in Houston, Texas with My Houston Surgeons. And today I have Dr. Kristy Hamilton as a guest on our show. Welcome, Kristy.
Thank you so much. So excited to be here with you.
So this is exciting because I don't always get to have somebody in studio, but Dr. Hamilton is a local Houston doctor. What area of town are you located in?
My practice is located in River Oaks, and I live in Southside Place.
Awesome. So we're going to touch on a lot of really interesting things and a lot of things that I think are very much, I hate to always use the word trending, but there really are. There are things that people are thinking a lot more about right now. But I always like to know, how did you become a plastic surgeon? What brought you into this specialty?
So I was that little kid that always wanted to be a doctor, like the little plastic doctor bag, the stethoscope, like trying to cure everybody.
Yeah.
So I wanted to be a pediatrician. That was my dream. And then when I was in middle school, I just had like a freak track and field accident and got cut with track spikes in my forehead, just a complete accident. So I met Dr. Din.
Oh, really?
He's my plastic surgeon.
Okay.
So a reconstructive plastic surgeon who was like the young guy taking all the call at the time, fixed my forehead and then lasered me for the better part of a year afterwards. And I just thought he was like the kindest, most compassionate.
He still is. He
Still
really
is.
Yeah.
Present tense, was and is. And I was like, I want to be just like him. He let me shadow him when I was in high school, and that was my first time in the operating room. I was like, this is it. This is what I want to do. That is so
cool. You got like a head start that most people don't have.
I did, yeah. So I got to be very, very focused, and that helped. You know, you always had to consider other things because you don't get to see everything when you're so young. But I thought the operating room was magical, and I thought putting people back together and fixing problems was really magical, and fell in love with plastics.
That's awesome. So I actually was also like you. I knew from the beginning I wanted to be a pediatrician, and my grandmother was one. And so I was like, well, that's what I'm going to be. And then I knew I wanted to do surgery, but I did not get introduced to plastics really until medical school. Yeah. So, but I love that because it's just like when you have something that drives you, and you got to spend so much time early on.
Yeah.
So did you train locally, or did you go out and train?
So I finished high school in Canada. So we were oil and gas people, so we moved back and forth. So I graduated from a high school up in Toronto, and then I went to Vanderbilt, and then I did all of my medical and residency training in plastics at Baylor College of Medicine.
So it was like you slowly worked your way back to Texas.
Exactly. That's what I told my parents too. I was like, this has been great. I'm going back to where I feel like I belong. So yeah.
And you have a very diverse practice. You know, there's some people that they're like, I'm the one person, I do this one procedure, but I know that you do multiple things. You do them very well. And one of the things I really wanted to talk about, which we've heard the term a lot more, is breast preservation. So can you explain to our listeners what that exactly means?
So I truly believe there's a revolution going on in breast enhancement surgery right now, specifically involving breast implants. And we are, in a lot of ways, just catching up with the rest of the world. And so it's not that controversial, but it is new to the U.S. audience. I think for a while now, many of us have been trying to preserve the function of the pectoralis muscle, the pec muscle, or that main chest muscle, and not cut it, but we were a little bit limited by the technology that we've had. And coming out of the breast implant moratorium and everyone going to saline implants, placing these implants in front of the muscle just didn't look very good.
Yeah.
Really high rates of abnormal scar tissue around implants, the kind of saline water balloon
waterbed look for,
and you know, oftentimes you're doing breast augmentation in women that don't have a lot of breast tissue. That's the reason they're having it. So I think the majority of the U.S. plastic surgeons kind of shifted to going underneath the muscle. And that made sense at the time. But then we lost a little bit of that training or understanding of going in front of the muscle. So fast forward now, having some technology we'll talk about that's designed for going in front and just complemented by other advances like fat grafting. Now we can convert even more patients, I think, to good candidates for going in front. And there's just so many benefits, both functional and aesthetic, and I'm excited to dive into those.
Well, and I think one thing that we also have become more aware of is that sometimes it's not just, like you said, it's not just one thing. So maybe it's doing a composite breast augmentation where, you, like you said, you're doing fat, you're doing an implant. It's not just the way we used to think was kind of like, okay, this is what we have, it's done, we're over with it. And I also think that preservation, like that term, some people have really adopted it and other people roll their eyes at it. And I've seen that in videos and comments, and I think it's hard to change sometimes when you're used to this is the way you do it.
Yeah, and people do these operations very well. The way that they've done it, like people have been doing this operation for 30, 40 years, it's great. And the one thing or 2 points I like to bring up is, one, their before and afters, they look fabulous when patients are not moving. They look great. And then you ask those patients how they feel when they're engaging their pec muscle, they're in their Pilates classes. Like, women nowadays, we're more active, we're encouraged to lift weights, we're encouraged to exercise, and they, a lot of women don't like that their implants, if they're under the muscle, like move. And I call them dancing. So,
but not a good dance.
Yeah. And so that's something when, I see patients for primary breast augmentation, and then I see many patients for revision, and we're repairing their muscle, reestablishing that tension on it, hopefully giving them more shoulder stability later in life, because maybe not when you're 20 or 30 or 40 or 50, but I would posit that when you're 80, you'll really appreciate having that full pec strength back. And so I think there's an aesthetic and a functional reason why preserving that muscle, if possible, is important.
Well, and I think it makes sense. I mean, we started right in the 70s, they started doing this with reconstruction, right? Like, we started saying, okay, we shouldn't be taking the muscles when we're using tissue transfer. So it just makes sense that we would do that across the board. Why aren't we preserving everything when we can?
Yeah. Like, why do we have these muscles in the first place? Like, there's a reason for them.
They do have a function.
They have a function.
They have a function.
Nature is a very, evolution, very, finely tuned processes that are going on. And then I would argue that I think it looks better in front of the muscle too, if you don't get capsular contracture.
Correct. So that's a common question. I'm sure you get that I get from patients. I'm sure you get patients. So like, well, I thought it has to be behind the muscle to lower my rate of capsular contracture. Like, how do you answer that when they say that?
So where we were when we colloquially say in front of the muscle. I think you probably as well. We go in front of the muscle, but behind what's called the muscle fascia. So it's not exactly in the same plane that they were utilizing before, which was, in the gland of the breast, really, in a lot of ways. Also, our technology, and not just Motiva, but in general, has really, really advanced from those early days when placing implants in front. It's almost like a guarantee of getting capsular contracture. So when we go in front of the muscle, but behind the fascia, I think that's still a very adequate layer between the implant and the natural bacteria that are found in the glands of the breast. We know that this is my favorite device right now, the Motiva. I like it because it's got a less than 1% capsular contracture rate, but even before they came to the market, I was still going in front. I was utilizing more mesh, which I still utilize, but I was trying to use a bunch of different products and also techniques, and combined together help decrease that risk, because it's never going to be zero.
That's true. And I mean, like we always say, right, if we operate, there's always going to be something. But anything we can control to minimize it, then at least we can bring that complication rate down to as low as possible. So you've mentioned Motiva implants a couple times. You brought a pair today. Yeah. So let's talk a little bit about them. Obviously they're newer to the market in the U.S. Yes. They're not new necessarily worldwide, but what are some of the reasons that you like these versus some of the other available implants?
Yeah, so these have been on my radar for a long time. Was plastic surgery is a global field. We've got colleagues, you and I, all around the world. And so when you hear people saying that they're really excited about them in South America or Europe or number one breast implant in Asia, like that piques curiosity. I'm like,
something's
why?
different there, right? Yeah.
So I had heard that initially from my friend, Dr. Roy Kim. And so he was like, oh, I hear they're coming. And he was like, you should pay attention to this. And so what I like about them, and the study I found most compelling was the Nature Medical Engineering article. And I love that this company had taken the time to look at what the best surface is, the one that's most, in their view, biocompatible. And they looked at mouse models, they looked at rabbit and also human to see which surface yielded the least amount of scar tissue production. And it was this micro variable surface, the 4-micron smooth silk. And so I thought that was great. I was like, I can't believe a study like this hadn't been done before to my knowledge. But how great that we now have something that keeps those cells, the fibroblasts that form scar tissue, kind of calmer. And
they don't see it. It still while it may not be exactly 100% us, they don't recognize it as being as foreign.
Yeah.
Right. And I think that I really like these implants as well. And what I liked is that there had been a long time where there hadn't been quite as much innovation in that space. And I think that, it's always good to have somebody newer come in, and it pushes everybody to be better.
Makes everybody better because you want to keep some healthy competition in the market.
Exactly.
So I'll be excited to see what the other companies bring to the forefront too. And I know Motiva is already kind of planning some future innovations coming down the pipeline. So we'll see if those will serve our patients well too.
Exactly. Innovation is good for everybody involved.
Yeah.
So let's change gears a little bit, because as much as I love talking about facial plastics as well. So tell me a little bit about your approach to facial rejuvenation.
So I am a big fan of what has been coined in the media as the undetectable facelift look. And to be fair, if you have waited a long time and are having a facelift, then it's probably not going to be undetectable. But I think when you see, and we don't necessarily want to name celebrities, but these beautiful glow up transformations of women who are in their 40s, let's say, and you're just like, wow. They just look.
They look like they're so rested.
Great. They're so rested. Did they have a spa weekend?
Yeah.
That I think is the power of the modern facelift done well, and it could be facelift, brow lift, eye lift, some very tailored, customized set of surgical and maybe even non-surgical interventions to address all the components of facial aging, but we do it at an earlier entry point so that it's not so obvious, in fact, undetectable.
And I mean, right before it used to be wait till you look bad. Wait till you look rough and then do it. But you're right. And we're not only just maybe doing that surgical intervention earlier, but we're also doing a lot of other smaller things. So we're doing better maintenance too.
Yes. And it's comprehensive, right? You and I, we don't just talk about the surgical components. We want to make sure the skin is on point. We want to make sure your maintenance plan going forward is going to be great. You're still using your neuromodulators and toxins. All this new regenerative medicine is really exciting. We can talk about that too. But I love the use of, again, restoring facial fat. We want to restore volume where needed. We want to truly lift what gravity has descended, and then meticulous focus on scars so that we have a durable, really elegant and understated result.
Hopefully you can wear your hair up and you really can't see.
Yeah.
That's really what people want, is to feel comfortable, not to have that be the focus, but just how good you look be the focus.
Yeah.
What's also changed a lot over time is we used to just feel like I said, it was one component. We just pull the skin and we're looking good. But we know, like you said, there's multiple components. We know it's skin quality, it's volume changes. So I think we're getting better in plastic surgery in all areas of the body, really focusing on it's not just one thing.
Yeah. And then when you don't try to treat everything with just one, that's when we can have these really lovely, really elegant results. And so I think we've really figured out the different components of aging well as surgeons, and we're surgically addressing those in a much more effective way.
Well, and now I'll ask you this. So I always like opinions when people do a lot of facelifts, but everybody has their own, and I can't tell you that there's necessarily one right or wrong answer to this, but like there's always the debate. Deep plane versus doing it or the periosteum versus doing SMAS. So what's your preferred technique and why?
And it may vary patient to patient. I'm doing deep plane right now, and patients ask, "Are you going to do a deep plane?" And I'm like, "Yes, I am doing a deep plane." But do you know what that means? What that means? And I think you have to meaningfully lift the deeper like the SMAS layer, whether you're going under or tightening it. I mean, I was so impressed at ASAPS by one of the lecturers who presented just SMAS plication. I mean, it was like unbelievable, the results. And I was like, those are really beautiful. So I agree that I think it's the quality of the surgeon, patient selection. But for me, I found that I get a more powerful lift with the deep plane. So when I transitioned to that, I became a lot happier with like the durability, I think, of the results.
Will you explain to our listeners what we mean when we say deep plane?
Yeah. So the original facelifts, like way long ago, were just taking out skin around the edges and just tightening that, and
which is why people look the way they
and it looked so bad. The scars were terrible because the tension was all on the skin. And then, what would we tell you if you were having like a big mole or like a cancer cut on your face? Like, don't worry, it's gonna be really, really tight. It's gonna relax. It's gonna just take a couple minutes to relax. Yeah. But then we're like, oh, your face is gonna last 10 years. Like, no, because it's the same thing. So in some capacity with your facelift, if you're gonna have a longer term result and a nice result, you have to tighten the deeper structures of the face. That and the skin just needs to be lightly draped back, and whatever extra there is will go. So that structural component of the face we call the SMAS, the superficial muscular aponeurotic system. We don't say that. We call it the SMAS because it's just way too long. But that's where all the debate comes in. How do we do it? How do we reposition it? Do we go vertical? Do we go vertical and back a little bit?
And this can become a very heated argument in the right room of people, the right population.
Oh, yes. And there's people, this is like a very black and white. Yeah. And the reality is there are people on polar opposite sides of like how you manipulate that tissue, and they can have really lovely results. So I think that's where like surgical skill and understanding anatomy and that comes into play. What technique are you preferring right now? Because we're always evolving.
Right, and I agree with you. I'm saying like most of the time I'm going to be doing a deep plane, but there are definitely times where I've done even like a max lift, which is a suspension lift. It's all about picking it for the right person. Yeah. And there are a lot of people that like people will recognize and be like, oh, that's a big name in a facelift. I mean, they are not one trick ponies. They will really look at the person, what their goals are, and figure it out from there. But I would agree. At the end of the day, we want to relift what has fallen, and it's not just your skin. And things can re-stretch. So I feel like I get the most predictable results when I can do a deep plane as well. It just makes sense to me. I think that a lot of plastic surgeons get a little scared by the idea of it because maybe they didn't get as much training in it. But I think that once you feel comfortable with it, you can get such a predictable result.
Yeah, I think, and it's actually a really nice plane of dissection too.
Exactly. I like it. It's actually like, once you feel good, you're there. It's just, I know it's hard for people imagining who aren't surgeons listening to this, but there's sometimes you just pop into the perfect place and you're like, oh, this is great. It doesn't barely bleed and everything looks good.
It's just a very pleasant surgical experience, and that's what we want. But and then I'll pair that with fat grafting, and then we're taking like other components of the face into consideration. We're doing brow lifts as well, eye lifts. Laser, I'm a big fan of laser resurfacing, because I love to do that at the same time so that the quality of the skin matches this new structural lift that we've done. But I think that's one of the beauties of being plastic surgeons that like love to continually get better is like, you talk to you or I in 6 months and we'll have tweaked our technique. We might be something a little different in the neck, something a little different in the face. So it's always changing. And
you want that. You don't want a plastic surgeon who's static. If we are doing the exact same thing we did when we were training, then we aren't doing something right.
Yeah. And that's the same thing. Going back to breast.
Yeah.
It's like, just because 80% of the breast augmentations in the U.S. are done under the muscle and have been for a really long time, that doesn't mean that we should necessarily still be doing that, especially when that statistic is flipped outside of North America.
Exactly. And I think in the U.S., we, like many things, sometimes we decide we're going to do things one way and the rest of the world will do it. But there's so much we can learn from how people are doing it elsewhere. And I think that's part of the reason I liked the specialty. Was, to me, it was like I can keep changing things and I keep learning stuff because we're all kind of artists at heart. We like to do that type of thing.
Yeah. And our patients, their requests of us, and as patients want different things, like, we will evolve with them. And so I think, that's, as women have been getting, like, boss babe, mom, fitness, can bench press, whatever. Like, now, like, it's my patient demographic has shifted quite a ways to people who are very, very fitness oriented. And so I have to be able to offer them something that's going to meet them where they are in their life.
And I think we, like I said, we always try to stay away from saying our bodies are trends, but I'm really happy with the way that people are moving towards healthier, like healthier, active, and I think that's still all really beautiful. But I think that we're putting our focus more on not just beauty, but wellness.
Yeah, absolutely. I mean, the GLP-1s advent of Ozempic, semaglutide, tirzepatide, whatever brand you want to say, like, that is, like, I think people are now getting so successful in their health and fitness journey that, people they're allowing themselves to get a little excited about it.
Yes, exactly.
And so, like, everything's changing. It's really wonderful.
What's something that you're really excited about? That's something maybe like that's your next new thing that you've been hearing about, or something new that you've incorporated into your practice?
Oh, my next new thing is I'm excited about the AlloClae. So it's cadaver fat, which maybe sounds like alarming, but it's supposed to have a very high retention. And I am, for the same reason with the very, very fit, low body fat individual, I'm really excited about having something that, if they don't have their own fat to transfer to breast cleavage lines or something with implants, or a little hip dip, or just don't want to have liposuction, I'm excited about having, like, another off-the-shelf durable product.
Because prior to this product, there was very, like, 1 milliliter was available and quite pricey. So it wasn't a great option. And you do get some people that, like, if you try to borrow fat from somewhere else, it's going to leave where you're taking it not looking great. So I am excited about that too, and to see how long-term things hold up with it as well.
Yes, because if it works as well as they're presenting it to us, which we have to assess it with our own hands and eyes, then that's going to be really great for patients to have, like, a body filler product. We don't really have that.
And I mean, I'm excited for future-wise. Like, right now, like you said, it's cadaver, which means it's processed, but it's still, human-derived. And I feel like we will get to one day where we're able to grow adipocytes and then transfer them, which is fancy word fat cell, but, like, I think that's where we will eventually get to, where we don't need to borrow it from elsewhere, that we can just take somebody's fat and grow it.
Yeah, true, customized. Yeah, that makes perfect sense. Grow it in a lab, and then that's your fat.
Yeah. So I'm sure somebody out there is working on this right now, but I'm excited to see it when it happens.
If not, we should do it.
There we go.
Okay.
Nobody else heard that. We're working on it.
We'll snip that from the podcast, yes.
So I know that you have other interests outside of plastic surgery, like most of us do. What are some of those things? I know that you are an artist yourself outside of being a plastic surgeon artist.
Yeah, I've always really been a great admirer of the arts, and growing up, I had a real affinity for color pencil drawings, and so I actually used to sell my art. Now I refuse to part with it, so I I keep it, and I've since transitioned to more acrylic painting. But I find it's very therapeutic. It's relaxing. It's it's fun. I enjoy it. So I've got a big easel set up, and mainly my little baby just likes to run through and rip everything apart.
If your daughter is now kind of gravitating towards and creating art with you.
Yeah, we'll get her little hands like finger painting on the acrylics. This is our house is now her house, so it's her easel now.
It really is. So, well, that's wonderful. I think that it's nice to have something that's outside that you enjoy, and maybe you should consider. Have you ever thought about applying to the physician, the healing arts, and like showing your art?
I could do. Yeah, I'd love to do that.
It would be really cool.
Okay.
It'd be really cool to do it. You should do it.
Okay, I will do it.
But what are some other things that are coming up this year that like you're really excited about?
We're doing some traveling with my family, so I'm really excited. We're going like the whole clan, extended, and the baby. We're all going to Italy together, so that'll be
so. Will
really
this be
fun.
The first big trip for your daughter?
First big trip with like everybody and my parents, my husband, my brother. So that'll be really special. We haven't gotten to do that in a really, really long time.
That's awesome. I'm glad you're getting, like, a lot of people will ask, especially when you're a women's surgeon, they'll be like, how do you balance it all? And I try not to ask that because I wouldn't necessarily ask that if you were a male plastic surgeon sitting there.
Yeah.
But I think that as humans, we can all use a little bit of balance in our lives. So I'm really glad that you're getting to go out there and enjoy.
Yeah. That's been like the greatest addition in our life, just like having her. So it's fun. And I don't mind answering that question because I think, women, like we do wear a lot of hats and maybe the men wouldn't get asked that, but also like maybe we all play like slightly different roles in our own homes. But I would say there is no balance, but it's a lot of fun. And if you love something, your child, your family, your work, your art, you make it, you just make it happen.
You do.
Yeah.
You do.
And I know you do. I know you do that.
I think that's one of the things. Houston, we're like lucky to be in such a cool city. We have so many talented plastic surgeons, but it's not even just that. I just think that we have so many motivated people who do more. Like when I think of them, they're more. There's even more than outside of it, right? Like I just know like a lot of strong business women, a lot of people who are really active in our societies. Like any other specialty, we have professional societies, and that's how we teach people. We learn from each other, and that's how we all further this education to learn more about all these things that we're talking about today. And I feel like in Houston particularly, we really have a large group of people who are leaders in that world.
Yeah, leaders and also kinds, also collegial. I think we've got an amazing, our Houston Society of Plastic Surgeons is great, and I'm very grateful to be part of such a wonderful community. Like it's always people helping each other out, bouncing off ideas, and I think we're better off as a group because of that.
I do too. I think that we're really not competition. There's so many people in this world, and we can collectively do better taking care of them.
Yeah.
What's something that you find has been challenging? Being because you have your own practice, you're a business owner, you're a surgeon. We get a lot of students who listen to this. We're exploring going into plastic surgery or residence. So what's one challenge that you've had as like a plastic surgeon owning your business? And how have you handled it? I feel like I'm giving you like a pimping question, but I always like to know this stuff. So
I think that's a very broad answer, but it's been learning the business of medicine, like the practicality of, like maybe how you think something should go is maybe not how like a bank does it, or like when you're building a building, like pursuing like lending and how long that process goes, how long it takes to build something, how you set all this up. But it's also been like a very, very fun. Like I've enjoyed, like I feel like I'm getting like a mini MBA on the go, but through like the school of life or hard knocks, depending on how you want to look at it. But, I think as people who've been career students for a long time, like I enjoy kind of figuring out that process and ultimately like building something where I get to like bring something really great to my patients. And so that's been probably like the hardest part, just because I don't know about you. I never took any like business or
I think we had classes. Maybe one like lecture once.
Yeah.
For maybe a person in town who was like, this is how I did it. In 1 hour,
Yeah. So I think, to your point earlier, just like we all know people who have done this, like yourself included. And so you ask good questions, and I think, we're not trying to reinvent the wheel here. Like people have had successful private practices. So just talking to some of our colleagues has been really helpful too for good advice.
And I agree with you. I've enjoyed the business side. I never thought I would. Like part of the reason, like I'm in a group, I was like, oh, I'll just put in a group. Does somebody else take care of it? And now I'm like, no, I want to take care of it. I want to be the person doing it because it's, it's just another extension of our care. So details matter and things, and it's nice when you're the one that gets to make those decisions.
Yeah. So. I enjoy being able to pivot really quickly. If like we see something that we want to change, we just, you don't have to run it by anyone. You just do it, or you run it by your partners. It's a lot more, we can be a lot more efficient, a lot more nimble than in a hospital system. If we want to bring something on, change something, like we can do it, and we can do it like really, really quickly. And that's been really fun.
There's a lot less hurdles than you might have when you're in a hospital based or an academic setting. Yeah. There's positives to every practice setting, but like I'm happy the one I chose, and it sounds like you were happy with what you chose.
Oh yeah, for sure. I would do it 100 times over. Yeah.
Well, if someone's listening and they're like, gosh, I want to go see her, what is the best way that they find you?
So through my website, drkristyhamilton.com, that has our phone number, Instagram. It's also on most social, Instagram, TikTok, at Dr. Kristy Hamilton, and my team will be in touch.
And she does a great job educating, has a really great social, so it's worth checking out. And I was kind of, end up our conversation with Dr. Hamilton is not only an elegant person, but does very elegant surgery. And so it's definitely somebody worth checking out. And thank you all so much for listening, and thank you for being on this episode.
Thank you so much for having me as a guest. It was an honor and a pleasure.
I hope you enjoyed this episode of The Confidence Doc and learned something. Please check us out next week, next episode.